the Department of Health has announced the outbreak of diphtheria disease at the Pollsmoor Correctional Centre in the Western Cape. This follows the death of a 19-year-old inmate last week, 5 days after he presented with symptoms and was referred for medical care. 8 other inmates have since tested positive, 2 of them presenting with mild symptoms. Now, the other 6 were asymptomatic. Diphtheria it's uncommon, but vaccine-preventable serious infection caused by a toxin-producing bacteria will, of course, cause diphtheria. The symptoms of diphtheria include a sore throat, swollen glands, and that's particularly in the front of the neck. But to give us an update, we are joined by Singabakho Nxumalo. He, of course, is the spokesperson at the Department of Correctional Services. Singabakho, thank you for joining us. Good to have you on the program.
A very good morning, and thank you for having us.
So let's perhaps talk about what we understand from reports, and a media report coming from the department is that there has been 1 death. We've spoken about some of the infections, but obviously it's been the weekend. Have there been any other cases reported, any other deaths? Will you give us an update?
Yes, we are still standing at 1 death. Remaining with 8 positive cases. And what is giving us courage is the fact that we have not had any new cases for over 5 days now. And as a department, we are not leaving anything to chance. We are continuing with the measures that we've put in place that will assist us in terms of infection control. And you'll recall that we had 54 remand detainees from Medium A, Section B, that were identified as direct contacts, and they were tested, and 46 of them were negative. We remain with that particular figure. 15 of our officials were also identified as direct contacts, and all of them were tested, with I think 3 which were who had symptoms, but they were all cleared. So as a department, what is important at this stage is to ensure that we do whatever possible to contain this disease, not to spread to other sites within Pollsmoor or even to other facilities outside of this one. So as a department, National Commissioner at 10 will detail what is it that we have done thus far. And we've been working very closely with the Department of Health here in the Western Cape. And I must say that I think we've managed to put together a very strong fight. Hence, the situation is what it is right now.
Any ideas how this actually started? I mean, we don't necessarily hear too much about diphtheria these days, but any idea of the origins? How did this situation begin?
That investigation is ongoing, and the health team is leading in that particular aspect, because what remains important here is to say the index case, unfortunately the deceased, how did he manage to get the infection, and be diagnosed with this disease? All that we have thus far is that he went to court in the early October. He came back, he was fine, and after a while, then he was not feeling well, and that would be like more than a week or so. So we are not, saying that he got it from court, but we're saying now we're trying to monitor each and every movement where he was involved. And then when he was not feeling well, the healthcare professionals in our space treated him. And when he was not improving, a decision was taken that he be taken to an outside hospital facility, and that was done. It was only on the 2nd of October that he was diagnosed with diphtheria, which is something that's then said to us, we might be dealing with something big here, therefore we needed to act. And unfortunately, on the 5th of November, he passed away. Yeah. So as a department, we then said, we learned a lot from COVID-19, so let us go back to those practices that we're doing at the time, so that we can, in a way, locate how this disease managed to find its way in our facility and how best can we protect other inmates. Because you remember, this is a correctional facility, high concentration of people. So everything that finds its way inside, if it's deadly, it has to be managed. Otherwise, we'll find ourselves under a serious situation where we'll need to do even other more drastic measures. So as a department, it's important that epidemiological investigation is concluded so that we know exactly how the index case got to be infected.
And indeed, it's also driven by vaccinations, the prevention of it, and that's why we don't hear too much of it. So, what about the whole vaccination drive, and in terms of the immunization against diphtheria within inmates? How is that going? Obviously, it's hard to be up to date and to know whether most of the inmates have had it or not. But what is the process here?
Fortunately, this is a disease that is curable, and we know that there is a vaccine in that particular regard that is able to fight it. But it's taken at a very young age, I think from infant stages. So we're working closely with the Department of Health even in this regard. We've never reported shortages in that space. They've been providing us with relevant vaccines, so we've been administering them. The Commissioner will also detail how the 342 inmates have been vaccinated thus far, and that program is ongoing. But also, even in terms of our staff, some of them were vaccinated at a young age. At this stage, we only have 36, but the program is ongoing. But we're not only looking at the vaccination program. Even things like hygiene practices, deep cleaning of our centers, regular washing of hands, when people not feeling well and, covering their mouth, especially when they cough or when they sneeze. All those practices are coming back because they've proven to be working, and we've seen them making a difference during COVID-19. So as a department, we've gone back to all of those. The advantage, again, is that our officials and inmates are aware of such practices. So it's easy for them to buy into them. There's no resistance because they know of the difference that they bring to the fore.
Just to put this conversation to rest, because I know that there is going to be a press conference that you'll be having at 10 o'clock this morning, so we'll get more of an update about it. But, a lot of the time when you read of cases of diphtheria, it happens very much so in overcrowded places and places that unfortunately have very poor hygiene. The conditions within correctional facilities, obviously this would be a concern. I mean, if these are the kind of circumstances that the inmates find themselves in that is leading to the spread of it. Let's talk to that point.
Currently, as Correctional Services in South Africa, our level of overcrowding is at 44%. That is quite big. But it is not all facilities which are overly populated. Hence, I've spoken about the hygiene practices to say, even when we are faced with overcrowding, there are things that you can do and do them quite successfully. And to say, how do you ensure that inmates are alive to the measures that they have to take in, washing of their hands, covering their mouth, and even cleaning the spaces where where they're in. Even things that other people may take as it's not major, such as pest control. We're very strict on that because we know that should you have something or back in one particular unit or section, it can easily find its way in another unit. So as a department, we've made it a point that we even limit movements, at medium A, not just for inmates, but also for our own officials to say, after your shift, there is no need for you to wander around, go home and isolate if possible in case you may have been, a contact to those who are positive, the 8, but also for the inmates as well. How best are they able to protect themselves? But what this has done, it has also affected the visits coming to Medium A. Medium A is our admission facility. That's where your remand detainees are housed. So it now says when people are coming from court to Medium A, now we have to make it a point that we take them to other sections or to other centers within Pollsmoor so that we can contain the disease localize it, deal with it, finish it, so that you are able to protect these other centers which are within Pollsmoor. But this message is also echoed to other facilities in the country so that we prevent this disease having to find itself there.
All right, so we'll leave that, as I say. I know there is a briefing, a concise briefing that'll happen at 10 o'clock. We'll find out more about this. But let's talk about another case, and because another matter that has been our question of the day today here on Morning Live. It also has got a lot of people talking. It's the case that was brought to the court by Mbalenhle Ntuli. It's an inmate at the Johannesburg Correctional Centre, represented by Lawyers for Human Rights. And last week we saw the Supreme Court of Appeal ruling that inmates are allowed, or should be allowed, to use their personal laptops for study purposes. Perhaps let's get the response from the department with regard to this ruling.
The Department of Correctional Services has always been advocating for inmates to improve themselves, to further their studies. We do want to see them succeeding. And we know for a fact that inmates who are active in our facilities, when they are placed out, they never come back because there is a future for them. But what we were pushing for with this particular matter is that inmates having laptops in their cell does defeat the purpose of formal schooling, because we have many cases where inmates have used these laptops for other things other than studying. Some will even open up businesses illegally, so do things where they scam other people, where they hurt our economy, hurt other people, going to social media sites and do a whole lot of other things. The ruling that we had before was to say inmates can take their laptops to their cells without the modem. Technology has advanced so much that you no longer need a modem. If you are able to get a cell phone smuggled into your cell, you can create a hotspot and connect not just your laptop, even other inmates in that particular space. Hence, we went to court and said that ruling is outdated. We do have a mechanism where inmates are able to utilize laptops in a controlled environment where you have a network controller having sight in terms of what every person is doing there, where they're able to do research, they're able to send emails to their supervisors, and in case they also want to access other journals. But taking these laptops to the cells does more harm than building. Hence, we went to court. So that judgment does hurt us, but we are still studying it to see if perhaps there are no other avenues.
So that's my question to you. Is there a response yet? You're still looking at it, but do you think there will be appeal on this? Do you think you'll take this further?
There is still a case to be argued here because we've got more than enough evidence. We were able to pinpoint that the laptops in the cells are doing more harm than good, and appeal to the court to say, kindly look into this matter. But as I've said, our lawyers are going through that particular judgment, and they will advise us at the right time in terms of the way forward. But for inmate studying, that is supported. But taking these laptops to the cells, it's not assisting, because we do argue that the time that you give to inmates is more than enough, because they're able to go to the hubs that we have in correctional facilities, do their work. By the time they have to go back to their cells late in the afternoon, they would have covered a lot of ground. So having these cells, having these laptops in their cells, it's really something that needs another closer look, I think, by our justice system, so that we can work together here and try to limit the level of illegal activities that do take place through the usage of laptops. I
have to leave it there, Singabakho, but we know that it's been given 12 months. So the department's given 12 months to revise. So at this point, still, according to your knowledge, it is illegal for an inmate to use laptops in their cell. That's how it stands for this moment.
What's happening is that inmates are allowed to keep laptops in their cell because there are court orders in that particular regard. Yes, but when we went to court was to say, please really look into this matter because it's no longer building, but it's causing more harm than good.
Got to leave it there. Sorry, Singabakho, thank you for talking to us. I'm sure this will also come up when they have studied and reviewed the judgment. Singabakho Nxumalo, Spokesperson of Correctional Services.